Hello, everybody. Welcome back to our How To Corner with Dr. Will Gray III. In today's episode, we're going to discuss how to stop knee pain after ACL surgery and get back to playing pain free. The first thing you need to know when we're talking about ACL surgery is the type of actual grafts that are going to be used. We're going to focus on the two main type of grafts because these are the culprits in some of the issues you have post-op. Now, the people who are listening to this video up to this point, I'm talking to the people who are out of surgery, maybe you 4, 5, 6 months out, you're back to running, and you're wondering why you have knee pain still, or you have knee pain that you didn't have before. So there are two main types of grafts. There's the bone patella tendon bone graft, and you also have the hamstring tendon graft. The bone patella bone tendon graft is the most commonly used one, and it's a because of the fact it's a very strong graft. The only thing about it though, it tends to result in some post-op anterior knee pain, and that's due to the site of donor or the donor site where you get the graft from. The second one, the hamstring tendon, is one that people are trying to argue and show in literature that is just as actual strong as the actual bone patella bone tendon graft, but it gives you none of that issue with the knee pain. And as a result, it's a better graft in a lot of people's mind. But at the same time, you can't use your hamstring for approximately about 6 weeks. So you can't do any active hamstring, work at all. And to be honest with you, the actual data on that, as far as the effect of the hamstring um, atrophy, as well as the bit being a dynamic stabilizer of your actual knee or the dynamic stabilizer of that ACL, is almost a situation where you want more data about that. But let's continue on. So, what causes knee pain after surgery? First is the graft type. It is super, super important to understand that that anterior knee pain can be totally linked to the bone patella bone tendon graft because of where it's coming from. It's coming from the front of your knee, where your where people talk about they have patella tendonitis. That tendon, they chip a piece of the bone off on the tibia, and the chips off a piece of bone on the actual kneecap itself. As a result, you tend to have that area to be a little bit weakened, and the stresses of the tendon when you start to get back to moving and running over that particular area tend to be an actual problem because that stress area is very high. In addition to this, it's also the healing, right, that has to occur there. Sometimes when you're doing actual recovery from the ACL, what happens is that you don't necessarily heal the same as everybody else. You get a little slower, a little faster. And then also the collagen itself of that area has to go through multiple phases before it forms into what it quote unquote needs to form into. And then when you take a amount of actual tissue out in the area, it automatically weakens the area. Now, the last piece is the muscle atrophy part. This part is overlooked tremendously. When you're talking about anterior knee pain, the thing that offloads that tendon is the muscles. The muscles are the dynamic stabilizers or the dynamic components of your knee that absorb the shock of the actual stuff you're trying to do, like run, jump, cut, plant, pivot. And as a result, that repetitive trauma, the actual muscles braces that actual joint and gives that load opportunity to actually disperse evenly across the joint. Now, the muscles that are pretty much of problem is the quad, hamstring, hip abductors, and hip adductors. So everybody knows about the quad muscle, everybody knows about the hamstring, but people really tend to forget about your hip muscles. Why your hip muscles are important? Simple, when you're actually in a single leg stance or when you're running and one foot comes off the ground, what happens is that your hips have to be stabilized by your hip muscles or your butt muscles in order to prevent that quote unquote hip droppage, which then throws off the mechanics of your actual gait when you're running or how you run. And then lastly, when you're actually in stance on that leg, you have to prevent that knee or that angle of your hip from increasing where you have a lot of stress on the medial or the inside part of your knee in stance when you plant. So basically what happens, your hip drops inward when you're in stance or when you're trying to plant and run, that hips just really rotates in because it doesn't keep you in a neutral position so you can have that power and that stability. The atrophy that comes from you being in that actual brace for 4 to 6 weeks, extension brace, leg fully locked out, as well as um, the total approach of sometimes, open knee, um, open chain exercises, knee extension, tend to get overlooked early, where they don't realize you can start it after probably about 3 weeks, unless the doctor or the surgeon themselves want something different to happen. But even then, you really should hone in on that VMO, as well as your entire quad, and then the hamstring, as well as the hips. That atrophy has to be overworked, because you may not get your mass back, but the strength in the muscle fibers has to be equal to the other side, or has to be a place where it can disperse a lot of those forces. So now the question is, who's to blame? There's three people to blame besides your graft site. It's the physical therapist, the surgeon, and yourself. There is a really interesting relationship when you're trying to recover from this and not have that knee pain. See, that's what happens. The surgeon may have an ideal of how they want you to progress. Hate to say it, everybody's different. They're doing the surgery, they're not running with you beside you, feeling what you're feeling, right? And that's okay. And then the patient may have the inclination to return to the actual sport of choice quicker. I love when I hear people who are reporters talk about, well, ACL surgeries are so much more advanced now. People can get back in 9 months. Okay, sounds good. What position you're playing, how big you are, what's your body type, it really does matter. Quarterbacks in the NFL, if they're not mobile, they're pocket guys that can put a big brace on and, throw the ball, without too much of an issue. But when you're a running back or receiver, you're going to injure yourself again. It's just not when. It's not if you're going to do it, it's just when. So you have to be very aware of that. Like, when you're considering how quick you want to get back and you're the patient, you really need to think about it almost as a year. Like, I'm just going to lock in for this year to 16 months, come back right. And then the physical therapist, right? So the physical therapist, and I'm a physical therapist, I'm a DPT. A lot of times we get taught so wrong in school. Everything is a protocol, everything is a cookbook treatment. And that is mind numbing to me. Is because of the fact some of that stuff does hold some weight, a little weight, but it's really a protocol is really created off of healing times. Like, it's a reason why you don't do certain things until 4 weeks after. Simply, your follow up is probably in 4 weeks, and then it takes bone this much time to heal in like, and in 6 weeks you do this, and in 16. It's a reason for that. The ACL has to change here and there. You have to meet certain actual milestones. That's the healing time and the actual ability for you to gain what you need to gain to be able to progress. And then with that cookbook setup, what happens is that what you realize, there's a lack of knowledge in this actual field when it comes to how to avoid this anterior knee pain post-op. It just is. I literally treat people with ACL injuries for a year. Some people think that's crazy. In the setting that we have, we're a cash practice. My focus is you. My focus is really focusing on you. I'm going to treat you for a year. So, like, what does that look like? It looks so different that I can't even explain it on this actual talk. You have to just keep following us to kind of piece it together. And one day I may talk about it. Won't be today. But usually the cutoff for most rehabs when it comes to ACL is about 4 to 6 months, 6 months tops. After they get out to running in a straight line, they tend to say, okay, go back to school, somebody lifting, you're good. And most of them screw themselves out and they end up not playing to the level they want to. Now their mental is gone, they don't play as well. Their knee is hurting them now, they know what to do. So I tend to get a lot of people who are 9 months out or a year out who still have knee pain. And that's really, I think, a niche. That's what I do. And this is why I know this about the therapist can fail you. And the surgeon, what I talked about earlier about them not being with you, it's also an inattention to what you have going on follow visits. Because the visits are so quick. They're like 5 minutes. When you get in there, he talks, how you going, feel good, whatever. Some questions are not being asked. I've had actual people who have came to me 9 months post-op surgery. Out of surgery, ACL should be back playing, trying to gear everything back up, just least back on the field or something. They're 9 months out, and I had to tell them go get an actual another surgery. Why? Because they had a restriction in movement. their range of motion was not where it needed to be. And so they had some scar tissue there. Had to go get a cleanup procedure. I'm not going to share their name, but I mean, I can get them on one day. They'll tell you, like, they came in at 9 months and they had pain with every movement. And then I had to do some basic on court things to be able to see. And they just were not right. They just were not right. Like, they were not. So had to send them back. The surgeon is very integral to what we're trying to do, meaning that their intention, you have to almost, be so attentive as a therapist to make sure nothing is missing. If something is amiss, you make a phone call. So even if they do something with it or not, at least the patient is aware that you're on their side and you're trying to advocate for them. And then, like I said before about the patient, just not realizing that everybody's time frame is different. And here's the big piece: do your research. Find a quality physical therapist and a surgeon. Stop going to these people who do not know what they're doing. Like, just because the doc or the therapist in your neighborhood, don't go to them. You don't even have to come to me. Do research and go find the people who are good at their job. It's gonna be a lot harder now than it was, years ago. But when I say a lot harder now than the word years ago, what I mean by that, the pressures of the big box therapy buildings and the the mainstream therapy setups, they're just so tasked with having to have so many patients to make money for the clinics. It's harder, but you can find good people. Um, and if you can't find them, we're gonna leave some in the link today that you can click and you come find us. So those are people to blame, and it's because of the fact, as you know, we all want to get back to back scratching, two hand dunking, and doing our thing, but we have to do the fix, right? The fix. What do you do? How do you fix this, right? Here's how you fix it. Number one, intense specialized strength training. I repeat, intense specialized strength training. Number two, hands on recovery with modalities. And last but not least, patience. When you're doing your intense specialized strength training, focus on increasing the strength of the atrophied muscle group. I said that earlier. The strength needs to be improved of that group. Once again, you may never get that mass back you want, but the strength there needs to be at a place that you are noticeably even to the opposite extremity, or you perform at a level you were performing before without too many deviations. And please work your hamstring. Your hamstring is the main stabilizer of that ACL repair knee. Work it. Obviously, implement the hips and the quad work, but that hamstring needs to be worked. It is super important. Hands on recovery. Post play, post workout to prevent the accumulation of micro trauma, right? And you're like, man, that's a lot, that's a lot. Okay, simple. When you run, jump, when you play, when you go back to your sport, of choice, football, basketball, track, whatever, what happens is that you cause micro trauma. The muscles are shearing, or the muscles are having these little bitty tears because of the activity you ask them to do. They're having to do what you're asking them to do, and that causes some micro trauma at a level. And that micro trauma can accumulate, which leads to the actual presentation of that knee pain, especially in that quad tendon or the patella tendon, right? So you need to have post play and workout, recoveries in place. How do you get those? You need to have a good therapist who's willing to go that extra mile to figure out your recovery type. Watch you play, see you after the game the following day. And then you have to be a patient that's committed to it. But once you find your actual regimen, it's going to be cake. The hardest part is your patience, right? This takes time. Once you identify that regimen, like I just said, which takes time, it will work. Whenever you stop, your knee pain will return though. And it's because of the fact that you had a major reconstruction of that knee. So be very aware of the fact that with these knees, as you can see, that tendon, that muscle, that kneecap, that joint is very, very, very important to prevent that micro trauma and maintain a healthy knee so that anterior knee pain won't be a problem for you going forward. If you liked everything you heard today in the show today, man, on the podcast today, please subscribe, like, comment, share, all that great stuff because we're going to continue to drop stuff in this actual world of how to for us on our channel. It's a very important thing for us to give you free information. If we want to be able to treat you all and be able to show you all our actual ability, we have to give away free information. And for us, it's not about being right 100%. It's about trying to give you the best information to give you things to be able to implement and think about. So, if you're looking for us, or you want to see if we're available to be able to treat you, or you want to be able to actually just give us a call, click the link in the description and it'll say 3gen.com/booking. We'll give you a shout back and see can we address your issue if you having this issue with the knee pain. And with that being said, everyone, I hope you're having a blessed one. I'll catch you in the next one.